This morning, I'm going to talk to you about IVF. IVF, test tube baby, or in vitro fertilization. Many of you have heard of IVF, but not all of you understand what IVF really means. In vitro fertilization basically means fertilization that happens in vitro, which means in glass. So it's fertilization that happens in glass. Most of us imagine a baby sitting in a test tube, but that is not true, okay? Because the truth is that we use a small petri dish, but that is just a small thing. In about 4 minutes, I'm going to explain to you the elementary basics of what IVF is all about. The first IVF baby in the world is now 42 years old. And throughout the world, there are at least 7, possibly coming on to 8 million IVF babies. So that more or less tells you that A, IVF is certainly not a new thing, and B, it's obviously quite safe because there are 7 to 8 million IVF babies throughout the world. Right, so as a concept, IVF is actually not difficult. First of all, you have stimulation of the ovaries using various kinds of medications to get many follicles to grow. And remember that each follicle normally contains an egg. So you give them the medication to get many follicles to grow. Now, as the follicles grow, they are monitored. And finally, when the size of the follicles reach what is called a size of dominance or size of maturity, you then go for a process called egg collection. So the eggs are retrieved. We then obtain sperm from the partner, husband, and we fertilize the eggs with the sperm. Now there are 2 ways of fertilizing the eggs with the sperm. You can either put the eggs and add sperm. This is called co-culture, or the conventional method of doing IVF, which was the way it was first described 42 years ago. The second option is to identify one particular sperm and inject that sperm into the egg, and that is called ICSI, or intracytoplasmic sperm injection. Okay, so there are 2 ways of fertilizing the egg with the sperm, and then you culture the fertilized egg, which is now an embryo, for a couple of days in the lab, and then you transfer the embryo back into the womb. Okay, so you have stimulation of the ovaries to get a number of follicles to grow, you retrieve the eggs, you fertilize the eggs, you culture the embryo, and you transfer the embryo back into the womb. And that, ladies and gentlemen, is in a nutshell what IVF is. And interestingly, in the last 42 years, the concept of IVF has remained quite the same. Certainly, there have been some improvements over the years, or many improvements over the years, with regards to how IVF is done, but the concept remains the same. Now, 3 important questions that always cross your mind. Number 1, why is it that we always describe various kinds of protocols or regimes or recipes, if you may, to do IVF? Okay, now that's the first question. The second question is, why do you normally differentiate between the traditional way of fertilizing the egg using co-culture versus doing ICSI, which is better? Okay, and the third big question that's always asked is that when you culture the embryo, do you put your embryo back on the 2nd day, or do you put the embryo back on the 3rd day, or do you put the embryo back on the 5th day? And God forbid, there was even some patients who were asking, "Doctor, can I just culture my embryo for even longer than that?" What? Come back in 9 months, is it? Right. So to answer these 3 questions, I will come back.